Welcome to the TMTA Lunch and Learn. We're excited to hear all that you're going to share with us about important business, things important for our businesses. Take it away, Ian.
Yes, good afternoon. My name is Ioan Duca, and I'm the manager of marketing strategy and consumer transparency at Blue Cross Blue Shield of Michigan. I'm here with my colleague Shannon Nolan. We are here pleased to share with you the latest tools that we have available for all of our members in the digital experience arena. What I will be doing here today for the next 60 minutes or so, or more if needed, is walk you from A to Z through what the experience actually looks like for all of our members. This experience that I'm sharing today, it's not limited to the state of Michigan, meaning that no matter where you find yourself or where you have to put your plan to work for yourself, this travels with you. So the experience that we offer is national as well, especially when it comes to locating providers, putting your benefits to work for you, having to pay bills and seeing what your out-of-pocket costs are. All of those, we can do that from anywhere in the country. Our journey starts right here. If you take a look at your screen at bcbsm.com, for the duration of our conversation today, I'll always be moving from left to right to keep the conversation organized. So once you go to bcbsm.com, what really you'll want to do is click on the login tab at the very top. And depending on what your credentials are, if you're an agent, provider, employer, or member, you get to actually log in. Now, I want to tell you from the very beginning that what I'm going to be doing today is not walk you through a static demo. Demos are good for no more than 2 months because everything changes in the digital experience space. And now with the rise of AI, even more. So what I'm going to show you actually is the live environment. I'm going to log in under my credentials. You don't need to be concerned. I'm not going to share any HIPAA sensitive data. I will show you the experience as if I was, your employee. What do I get? Any employee of the company gets the same experience. So I'm going to be logging in. The only thing that you will see is my name, and then the password you don't get to see because it's encrypted. So the moment that you put your password in, and your credentials, you will be logged in. Now, what I want to state is that your user ID and password carries across any device platform that you may use. You may notice that I'm having my mobile phone with me. It's a company issued phone. I use it a lot when I travel, even internationally. The experience travels with me as well. So whatever you see on the screen, I'll demonstrate that carries into your mobile device as well. Our mobile app, it's a 5-star rated app. Feel free to download it and navigate and put it to work for you. When you log into, again, your secure member experience, you come to what we call the landing page. And ladies and gentlemen, what you are able to see right now, it's actually my live experience, okay? So a couple of things so you understand that I'm a fellow consumer of healthcare benefits. I'm on a high deductible healthcare plan. My medical expenses are quite a few because I have 4 young kids. And, I have to meet my $7,500 out of pocket before it's a free buffet for me. Guess what? I'm still $90.18 for the year before it's a free buffet, but I can't handle that. But I have young kids, so quite a few events happen. And as you can see right here, you land on your landing page. It's a personalized experience. Navigation tabs are at the very top. On this page right here, we give you a quick view of where you are in your health benefits management journey. Look at the very top, depending on what your plan is, you can see that populated automatically. You will be able to see where you are in your deductible year to date and where you are in your out-of-pocket year to date. How accurate is this? Very accurate. As a matter of fact, if you were to go to a pharmacy today and get a prescription, within 6 minutes or less, you'll pop up into the portal. So it's really instantaneous. For the medical claims, as soon as they're being submitted, they pop within minutes here. So the burden for the medical claims, they rely on the providers. Pharmacies, they're really quick right away. They won't give you the medication unless you pay. So that's why they pop right away. What you are able to see as you scroll down this page, you are able to see your 10 most recent claims. And what you can see, there's my wife, my son, and there's myself. You can see the most recent transactions. But if you want to deep dive that information, you just click on the various claim number and you can see what that is. Okay. That's a quick way of seeing where you are into your most recent activity. But at the same time, as I said, you got the navigation here at the top. And based upon what you are interested in learning about or seeing where you are at, you just put your cursor on it. By putting your cursor on home, you always come to this page. When you go to your coverage, based upon the totality of the benefits that you have with us, those will be showing up into your portal. Again, all of this are transferring into your mobile app in real time. So if you got your medical, your RX, your spending accounts, if you have your dental vision, everything with us, everything will be popping right here. I have everything with Blue Cross. I've been with them for 11 years. I'm kind of like all my eggs are in the same basket. So this is why everything is showing up right here. If I want to see what their last claims, my claims are for the past 2 years, they're always right here in the history. I'm the contract holder for my family, so I can actually navigate to every single other person in my family. Up until the age of 18, I manage that, so I have unreserved, unfiltered rights to that. When my kids turn 18, they can block me. Okay, so I can view my wife's activity because she wants me to, but she can block me. So whoever is the contract holder, you get to see the history for everybody who is under 18, and you do that by setting the correct controls into your portal. But again, 2 years of claims history, very important. Why is that important? Because let's say you find yourself, you go to an urgent care or an emergency room, and this happened to us with one of our kids, and we didn't quite remember what medication he was on, the complete medication. And one medication, erythromycin, we found out he's very allergic to. We were able to access that to see who prescribed it and be able to remind the physicians, we couldn't remember the name of the medication. This is the one that he's allergic on. Very important to actually know that you can do that within seconds, okay? 2 years in time, you can go and see who gave it to you, what's going on, and all of your claims. The doctors and hospital staffs where you want to spend a lot of time today, because that's what interests you. Locating providers, and also how do you pay the providers, quality information, and out-of-pocket costs. All of those are accessible from this tab right here. Health and well-being. Who doesn't want to live forever? I do, right? We want to live forever. So basically, we provide you with a lot of resources on how to actually prevent your health, management and preventions of your health, but also a lot of other important things that I think many times we forget about. One of those being the Blue 365 member discounts. Ladies and gentlemen, that's something you pay for. And we negotiate rates with a lot of third parties. Anything from your home to travels to even car buying. You may want to say, why do you show that on your healthcare provider, site? Well, these are providers that actually sometimes they do business with us. So they provide us those deals and we just share the love, right? So they're right here for you. So pay attention to that, go into that. You'll be surprised how many good discounts you can get just because you're a member. And then the various forms pertaining to your plan will be listed right here. So at a high level, this is what's on your portal right here. This experience, as you can see, it's quite simplistic, okay? We're not the Googles or the AIs of the world, but we've learned from them. So when you go to Google, what do you see? A big white screen, one bar, but that bar holds the power. When you come into our portal, what do you see right here? Pretty much the same approach, key links to take you to the right places. So number one, basically, if you are interested in locating your card, very simple. Who carries plastic cards with them anymore? Some people do. I don't anymore. There are too many. Because I can have my ID card, screenshot, put it in my wallet, it's easy to access. You can click on this. If you log into your mobile app, you are at the doctor's office, or even right here, let's see your provider. I can text it to you. I can email it to you. I can Snapchat it to you if you want me to. Any way you want to, I can do from my phone. So you can see basically your card right here, this right here, from right here. You can actually print it, you can order it, you can actually send it to the provider wherever you find yourself. So I think that you'll always have the option to have a plastic card, but very few people really want those anymore because they're so electronic right now. So you have that easily accessible to you. Again, clicking on the home button brings you to the previous page. What I want to point out to you right now, additionally to this, before we go into the a wealth of the information, is you have a virtual assistant to assist you with any questions that you might have. This is our small version of the AI. You click on virtual assistant bottom right hand of the screen, and you can type in here just about anything that's relevant to your plan. Let's say coverage, and I'm clicking coverage, and all of a sudden it's thinking, right? Our AI engine is thinking and is going to give me options pertaining to any type of questions that I can have pertaining to that. And look at that right there. It's a personalized experience. It's not generalized. I can view my UOBs. I can learn about my coverage. I can view my balances. I can see all topics. It talks to me in real time. Now, we're going to be adding down the line the option for you to talk with a live customer service representative or even talk to a person. That's in the works as we speak. This history, whatever you talk on this right here, gets saved. So you get basically a reminder into your portal. If in case you forgot what you asked, you can go into it. You can delete that or keep that. But that is pretty much how we become even fancier and give you more tools in case you can't reach us in real time on the phones. You can actually, in a digital way, find your resources as well via our chatbot. Another thing that I want to point out to you right now at this point in time is the fact that you have many choices when it comes to care. And this is when we get into the meat and potatoes part of our conversation. Your choices for care. Where do most people spend their money? If you think about that, paying too much for a care situation that didn't require to have that much of an expense. For example, if a pink eye going to the ER, for me, I'm going to have to pay probably about $3,800 out of pocket because I went to the ER if I don't have any other claims. Is that smart? No. But if I go to an urgent care, well, I pay $80, right? $80, $3,500. I've learned my lesson, right? So what we do based upon member feedback, we organize in a simpler way for you right here the many different options that you have, your choices for care. So you can go to any place where you choose to receive care if you think ER is the best place. But starting with the doctor's office, you can locate your physician. We got the 24/7 nurse line easily accessible. Virtual care, which is a big one. If you have your virtual care through with us with Blue, the Blue virtual care, it's phenomenal. You can actually talk to a provider within 3 to 4 minutes at this point in time. So, and I can actually demonstrate that. So it's phenomenal because, me applying my experience with young kids, kids throw up, kids get sick, they get a cold, allergies. You can talk to a provider from the comfort of your home 24/7, anywhere in the world where you are, and you can get a prescription sent, so on and so forth. So you can do that right here from your computer. Locate urgent care centers and then emergency rooms. So in one quick spot, we just give you the options to quickly, instead of looking for those places, where can I find that information? We can actually guide you to those places of care. Getting a cost estimate, and I know this is where you want to hear a lot about. I'll demonstrate that in a second. Everything comes down to finances, right? There's a physical health, and then there's the financial health. Of situations where basically if you don't manage your finances accordingly, you end up paying too much out of pocket for little medical procedures, right? You can come into our portal today and price out close to 1,700 medical procedures. That is a lot of medical procedures, not just in Michigan, but across the nation. You can price them out. You can compare it against other providers. And then basically you can see how that's going to translate into your out-of-pocket costs, how much money really comes out of your pocket. You can see how much your plan pays to the provider. So as an employer, you can tell your employees, by the way, I had an ACL surgery 4 years ago. My employers paid this much, and then out of pocket, I paid this much. It's a great value to show you working for us. This is how much money we pay for you as a company and how much money your share of that is. One view in one spot, and I'll demonstrate that. Additionally, as we know, sometimes we have to see specialists. All the specialists that we work with within the Blue Cross network, they will be displayed right here. Not just within the state of Michigan, but across the nation. I want to state that very, very clearly. Locating hospitals and locating ambulatory medical centers. And I will talk about that in a second. If you were to have, let's say, some blood work done in one ambulatory facility, which is basically a mile away from the hospital, or if you're going to go and have some blood work done in a hospital, you'll pay pretty much double the amount. Why? Because in a hospital, a full service hospital, there's more costs associated with that facility. So knowing that you have options and where you go plays a huge role into your bottom line expenses. Behavioral and mental health. Why is this important? Because it is. I think for the longest time, this has been a huge stigma. I think every single human being at one point in time needs some type of behavioral help. We all do because we're human beings and nobody's perfect. So I think we create a special spot right here for people who just want to talk or basically receive help. I've made use of this at some point in time where I was going through a lot of stress and I need to talk to someone, get guidance. It's easily accessible. There's this spot right here for you. Getting a second opinion, which is very important, when you get diagnosed. I think, especially if it's a situation where you have questions or you're a doubt or it's more serious, it's always worth asking a second question. We give you the opportunity to connect you with the right provider to do that. If you have your prescription coverage with us, you are able to also not just manage your prescription, but order your prescription from this portal as well. And we give you the ability not just to order them, but see what your out-of-pocket costs are. I can tell you anytime you order to receive your medication at home in 36 or 90 days increments, you save a lot of money if you were to buy from the pharmacy. And we give you the option to actually see how beautiful that works. Vision care, if you have that with us, you can do that as well. And then, you can hear that I talk in a very interesting and distinctive way. I basically travel overseas all the time. My coverage travels with me as well. It's important to know that. We've got providers, not just in Michigan, not just across the country, but all over the world. And I just returned from a trip to Romania. I usually have allergies for various reasons. I always look for an immunologist to make sure that things are okay. And I always locate a hospital in case I need help. So basically, I was so happy to know that there was a hospital in the capital city that actually worked with my Blue Cross coverage. I never had to use it, but it's peace of mind. They process my claims. I don't need to worry. I just show my blue card, it's taken care of. So as you can see, international coverage as well, and that's offered through the Blues as well. So these are at a high level the type of choices that you have for care. Let's start right now at this point in time trying to locate a doctor. We are from the top of the page, home, okay? We come to doctors in the hospital, and then we click on find a doctor, and this is where we are. Scroll down the page, and I'm going to go ahead, and again, these are for in-network providers. I'm clicking on that as we speak right now, and you will be able to see what I call the engine, where you put in your requested information, what type of a doctor you're looking for. Very simple, organized, and you can locate a doctor multiple ways while the page is loading up. You can locate it by last name and first name. You can locate it by specialty. You can locate it by gender and a few other things. You can locate it by zip code, by street number. Try to make it as simple as possible. So again, a personalized experience looking from left to right. This is my address right here. If you want to pay me a visit, do so. I'm not afraid of you visiting me, so there's no HIPAA violations right there. You can see addresses on anybody by typing in their first last name on the Google. There's your plan type. So doctors by name, doctors by specialty. Additionally, if you want to check places by name and places by specialty, you can do that. So let's go ahead and just test it out. What we're going to do is click on doctors by name. Let's say that I'm looking for Dr. Kotze. This is my primary care physician demonstrating that. And there you go. You have the option. You can go ahead and locate a physician. Okay. Let's say you don't remember the exact spelling of a doctor's name. You can do that. Just type a few letters. It gives you many options. Another doctor that I work with is Dr. Paquette. I believe this is how you pronounce, and this is him, John. When I was working at the Oakwood Healthcare System, which became Beaumont, which now became Core, what is that called? Corewell Health. So within 12 years, it changed flags 3 times. I managed the patient rights department at that location. So I used to work with this doctor all the time. There he is. He's still in the same place. You can go ahead. I'm just demonstrating. I just typed in first three letters of his name, and I can see it's him, the languages he speaks. If he speaks multiple languages, those will be listed here. And then we go down the list right here where he had his education, the group affiliations where he practices. But as you can see right here, it still says Oakwood Hospital Medical Center. The reason that it says that is because that's his preference, how he listed himself. And we give them the option to basically, and we check this yearly with them, so we honor their preference. He also has a private practice, and this is his private practice versus the hospital where he practices. and you can see basically the areas of focus for that practice. It's a total care facility, patient center. You can see that they accept quite a few plans and all the details pertaining to this particular doctor. Their hours of operations. If I want to check out to see quality details pertaining to him, you can see what they did to receive this distinction from us. You can see the certifications that they have on board. Scroll down and you can see everything pertaining to this particular place and provider. Okay, so this is for a PCP, basically, internal medicine in his case, how you locate a doctor. Let's go back to the dashboard. Let's say that I want to locate a specialist. You heard me talk a few moments ago, the fact that I had an ACL surgery, uh, active sports, things happened, right? 4 years ago, crack, it happened. So I had to see a specialist. So I have to manage my finances because we are a busy family with many expenses. So I came into the store. So I looked for a specialist that actually, here we go, ACL repair, ACL. Okay, ACL. Okay, let me go down right here. It should come up easier. I'm going to pick up a different thing. Oh, I'm under doctors and specialties. I apologize for that. I was supposed to be right here. Underestimate your costs. I was in the wrong place. So I want to price out a medical procedure. You'll come under the estimates, but I'm going to do two things at the same time, bring up a specialist and display a cost as well. So while this is loading up, what you can do, again, coming into our portal, and you open up your dashboard. The dashboard brings specialists, brings providers, but also brings costs in one spot. So what you can do is start typing in ACL, and all of a sudden it gives you options, right? So it's a knee repair situation. I select that, and all of a sudden it's defaulting to 25-mile radius from my house, all the providers who can actually see and do that surgery myself. You can increase your radius to 100 miles, or you can search anywhere across the country. You can search in the US Virgin Islands because we got providers there as well, or in Alaska, or in Hawaii, or wherever your vacation places take you. And right now it's thinking, and what it's trying to do right now is calculate how much money I will be having to pay out of pocket if I had to have the surgery done today. Same time, it's going to give me all the providers within 25-mile radius from my house, all the specialists who are able to attend to me. So this is actually real life data as we speak. So it's taking a few moments while it's loading up, and it's also based on the connectivity. And voila, the person that popped up, it's at the very top, it's the person who actually operated on me, Dr. William Kestel. So you can see right here a couple of things. I'm going to maximize the screen. Dr. William Kestel, I actually became good friends with him. And I'm seeing him next week for a different reason. What happens when anytime you have an invasive procedure pertaining to your bones, when the weather changes, you realize that a few things are not the same, right? So you experience a little bit of swelling and everything, tenderness, and just a little side comment. I booked him, I looked him up, and I said, can I have some x-ray done? Because I felt kind of sore this past couple of weeks. And he says, well, the weather changed. I said, but it's the first time that it happened in 4 years. He says, we don't live forever. It's your time. So I'm going in next week just to do a quick check on me. But this is my specialist right here, Dr. William Kestel. If I was to have the surgery done today, this surgery will be costing $1,922. Okay, this is how much money will be paid to the provider. If I was going to have the surgery out today, $90.18 will come out of my pocket, because remember on the first page, that's how much money I still have in order to meet my total out of pocket. Okay, so it's not a bad cost. I don't want to have to use it. Okay, I don't want another ACL surgery, but that just shows you how much money I have to pay. If I didn't have a lot of medical expenses year to date, I would pretty much have to pay most of it or out of it out of pocket, right? Let me click on this for a second and show to you the costs, how beautifully they're broken down for those of us who actually like to pay attention to numbers. And I do like to pay attention to numbers. What you can see basically right here is the cost details associated with this particular surgery. So here you go. So you're looking right here. I'm maximizing the screen. So I paid this amount, $90.18, and the insurance, right? My employers pays the difference, okay? So what goes into this cost? look at what goes into the cost, basically. Into the cost, the way that this is broken down, it's very simple at this point in time. I don't need to have a copay apply because I've already met all those in my expenses year to date. But if I didn't, all of those will be captured right here. So the only cost that I have is this. But if I had less expenses for the year, everything will be displayed for me. So I need it. So I'll know exactly how everything gets applied for this particular cost. Additionally, let's go back to the previous screen. What I wanted to share with you is that, you can go down right here and view all the other providers that actually can perform this procedure on me. This is 1 out of 64 providers that can actually have the knowledge to either do the surgery or treat me accordingly. But let's say that I happen to be in a different state. What do we do in that case? I'm going to go ahead at this point in time and go to the dashboard that we have. And we'll be right here. Find a doctor. I'm trying to save and not put us to too many screens. Cost estimates. Just a quick second. They didn't quite cooperate with me. Here we go. That's the screen that I wanted to be at because I have multiple screens popping up. Let me go ahead and close that. So we actually have screen sharing has stopped as the share window is now closed. I apologize for that. Let me bring that up again and see what happened here. Let me share my screen again. Ladies and gentlemen, I apologize it disconnected me for a second. I'll make sure to go back into it. One quick second. I'll be really quick about this. So would you, at times, if this disconnects you, you just lag back in? I'm logging back into the experience, and my apologies for that. As I clicked on the X, it took me out completely from the previous screen. I'm going to go back to the point to where you are able to price out a medical procedure and look up a specialist across the nation, not just in the state of Michigan. Okay, so remember this is our landing page. So from the very top of the landing page, you're looking for the 4th tab, which is doctors and hospitals. We click on find a doctor. Okay, as that's coming up right now for us, I'm going down on this page. I'm going to click on get a cost estimate. And okay, let's go back to ACL for a second. Here we go. It's bringing us up right here. So what you can do is, number one, basically go ahead and select up to 100 miles. Okay, you can do that and update that setting. Or if you don't want to, let's just do that just to show you how beautiful that is. So it brings providers up within 100 miles. So all of a sudden the radius, it expands. Or additionally, what you can do, going back under the find a doctor tool right here. Let's take a different route under doctors and specialists because I see it's moving a little bit slow. What you are able to do is locate those providers for that particular surgery or procedure across the nation. That's the one piece I'm trying to do right now. It's taking a few moments for the system to cooperate and catch up to me. Here we go. Okay. So this is where my address is right now. I can click on this and take it out. Okay. I don't want anything within Michigan. Let's pick a zip code that I used to live in Texas, 75224. Okay. Yes, this is correct. So what we're going to do right now, let's locate a basically ortho doctor if we want to within that orthopedics. surgery, and you'll see how beautiful this is. Take a look at this. I'm already in Dallas, Texas, right? Isn't that wonderful? And the fact that I can do this from right here, I can research this particular providers, and these are the Blue Cross providers within that particular zip code, okay? I can view their profiles, so on and so forth. I'm gonna come to the dashboard that we have right here and actually try to estimate the cost down in Texas to see how much money will that cost us. So this way, I'm demonstrating to you that our tool, it's not just limited to Michigan, but it's your coverage travels with you across the nation. Clicking on that. I just took this one out. You take it out and you put 75224 Dallas, Texas. I'm going to update this. And all of a sudden, it's going to search for all the providers within 25-mile radius that are located for us. Okay. This will take just a few moments. Yes.
Slow down
with the audience.
Today, with our internet today.
I can see the connection. It's a little bit spotty, but that's okay.
Yeah.
It's still thinking. It's also noon when everybody probably gets on the internet right now.
Ask you a question while we're
Please.
waiting. When you were on there and it showed your doctors in Michigan that you could have
Yes.
procedure done, could you have clicked on your address and changed that and just
Yeah.
hit enter?
Yeah.
And it would go to, you don't have to go all the way back out. And,
Yeah, you can do that. Yes, you can do that. The reason I've taken it is I'm taking all the basic steps,
okay.
and you saw that I clicked the X in the corner, so it took me out, so I had to come back in.
Okay.
So the answer is yes.
Okay.
So that's a good call. So right here, again, take a look at the providers that are in Texas, and you can see that pretty much our costs are on par. I'll pay pretty much the same amount of money. The allowed amount, actually, it's a little bit cheaper to have the surgery done in Texas by $200 and some dollars. Why? I don't know. Maybe because it's warmer. I don't know. But my out-of-pocket cost will be the same. Okay, it's just the allowed amount paid to the provider. But then, take a look at this. This is kind of interesting. This particular place, why will they? It's Texas Cottage Right Hospital for Children. Perhaps it's a more specialized procedure for children to have their ACL repair versus an adult. Who knows? But anyways, what I'm trying to say is that that's a little bit of an outlier right there. So this is one way in which you are able to locate providers and price out various medical procedures. I want to bring to your attention the importance of hospital quality. Okay. So basically, we are in the search engine where we price our medical procedures and where we locate specialists. Quality is very important. Okay. Scrolling at the bottom of the page, you are able to understand how we award certain quality distinctions to our providers. So clicking more about hospital quality will tell you our philosophy and gives you a nice portal to educate yourself with regards to our Blue Distinction Centers designations that we have. That are the designations that we award to our providers, okay? So that's one easy way to come and learn more about hospital quality. To this point in time, let me stop for a second and see what type of questions I can answer. What I've done, I've showed the basic login. I've talked about locating your benefits, locating your claims, understanding your accumulators, how all the costs are playing in, looking up a specialist, pricing our medical procedure, seeing how everything plays into your overall total costs. You saw this cost of $90.18 carrying through my balance on various medical procedures. What can you price in our tool? Anything from blood work, x-rays, heart stents, DMEs, doctor's visits, everything that's shoppable can be priced out. Obviously, brain aneurysms cannot be shopped out because those are life and death situation. Anything that it's not life and death, that it's a procedure that it's making sense, it will be listed on our portal. And that can be done for all 50 plans that we work with, okay? So any questions so far that I can talk about? What I want to do this point in time is switch gears and talk a little bit about the health and well-being part of our conversation here today. So we are in the secure member portal, right? So anywhere past the claims and past the doctors and hospitals, It's the ongoing management of your health. So we provide you with plenty of resources to learn more about your situation that you are trying to manage. So by putting your cursor on the health and well-being tab of our secure member portal, I suggest we start first with the WebMD Health Services. WebMD is our partner that we work with. And basically, you can see the various tips that actually you can access at a high level. Anything from podcasts, anything from rewards, if you have a rewards program with us, or learning about your health and various conditions, to exercise tips, to sleep improvement tips, stress management, everything is accessible right here. So I'm going to go to WebMD, click on it, and now all of a sudden I have access to all of that information. It's personalized to me. So if you have a health plan type of a reward program with us, it will be displayed for you right here. By coming into our portal, you are able to also import your various devices, your Fitbit, your Apple Watch, whatever you work with, and you can see how active you are. I don't do that because I just like my data to be on my Apple phone, not on the portal. It's in too many places. But I did that for a day, and I thought that was enough, okay? But those are my stats at some point this year. Okay, so right here at the very top, basically, what you can do is go and start exploring with the various podcasts and resources that we have. We always promote at a high level the behavioral health resources that we have because there's so much asked for at the present time. And then additional areas where you can receive help on. I'll let you take a look at this, anywhere from sleep to muscle relaxation to journaling, eating healthy. There's a lot of information right here, right? I'm just scrolling up and down so you can see that, okay? And then basically also your various well-being tools. If you choose to have your medical record imported, okay, into our portal, you can do that as well. I do that. I like it in one spot. You just basically connect two sites. For example, in my case, Beaumont, I link the two sites. It's important to my Blue Cross. So I'm not going to go there right now, but you can do that as well. Symptom checker, you can go ahead and assess yourself. Now, you're not a doctor. It's going to give you an educated feel for your condition. It's going to display that Pilates picture, and you put your cursor. But again, you can attempt to self-diagnose. This is not meant to be a physician tool. This is meant to help support, right, and give you education. So these are the WebMD resources that we have easily available for you. Additionally, what I think it's important to point out to you is, as I said at the beginning at the conversation, there's various, depending on where you are and you're spending with us, what programs you buy with us. There's a Be Well program that can be customized for you. There's a prevention and management program and resources that you can go and basically research for yourself. The one that I want to share with you, though, it's the behavior and mental health support, which I think is very popular right now, and I think it's important to be aware of. This is that in partnership with Livongo, and basically you come into this program in anything from diabetes to high blood pressure to weight management to healthy living to behavioral health can be offered to you, and you can actually get the help in depth based upon what condition you are facing. I really want to make you aware of that resource that's available to you, something to keep in mind. Okay, so let me stop here at this point in time and basically get a pulse check from you and see what are the additional things that I can cover as part of our conversation here today. Are there additional topics that you would like me to talk about today that's of interest to you?
I have a quick question.
Please.
You said you could have your medical sent to Blue Cross.
Yeah.
Does that help you out? Like, say you have to have a procedure and then you pre-authorization or anything? Does Blue Cross go in there and look at it and say, well, I see that you've had these tests and this stuff done? Or
the reason I do it is because I'm a little bit of a type AAA personality, and I like to see actually what's happening with me. So this is your secure member experience.
Okay. Blue Cross
So Blue Cross doesn't go into your
Okay.
medical records.
Okay.
Okay, we don't have the authorization to go into your records.
Okay, I thought maybe that was part of it.
That is because you want to be comprehensive
Okay,
and know what's going on with you. Okay,
okay,
no provider is authorized to touch your medical records unless you give them permission.
right,
My wife delivers babies for a living, but if her patients are not her patients, she's not allowed to touch that person's record. That's cause for firing, and that's a HIPAA violation. So Blue Cross has no business to go into your medical record.
okay. I just
Uh,
wondered if it made it easier for
it's
you as a
easier for
patient to
me.
get some stuff done.
It's easier for me when I see a provider to quickly show them what's going on. And it's easier for me. I monitor my blood work and everything else, and I want to know what's going on. And I've self-educated myself to the point to where every now and then I do reading. Oh, this is where my levels were. Let me just go back in and just check it. It's in one spot. So it's a great way to actually put all of your information together, but it's secure information. Now, if you want to share it and give rights to others to view, you can. It's your decision, but we respect your privacy greatly. So it's more of a convenience versus Blue Cross wanting to know. So yeah, that's a very good question. Because it's sensitive, right? It's your medical record, right? It comes in. So that's why I didn't go in that direction to share with you, because it's there, but I just told you can do that. So bottom line, it's convenience, nothing else. Blue Cross doesn't have a need for that. But a lot of our customers are asking us this question: do I have the option to import my medical record into your portal? The answer is yes. As we respond to new business opportunities, that's a key question that comes up. Can I view my medical record by coming into your site? Yes, you can do that. What else can you do? You can import your physical activities, so on and so forth. You can actually put in your body indicators, everything pertaining to you. If you want the Blue Cross Hub to become one spot where everything pertaining to you becomes, then do that. That's what I do, and I like it. But it's definitely it's a personal choice. Thank you for that question. Very well asked.
Is the data just linked, or is it actually on Blue Cross's website?
So basically, it's both. So you import it. It goes to your provider, right? So they're aware of the fact that it was sent over. So it's both ways. Okay, and you can stop it at any point in time.
Okay, it's good to know. Yeah.
It doesn't have to be forever. Okay. So another thing that I wanted to state again with regards to your choices for care, because I'm on this screen right here, what's important to know. I've mentioned, and I want to demonstrate this. Let's say that I want to talk to a virtual provider. Voila, I click on this. It brings me right here, Blue Cross online visit. I click on login. Okay. It's going to bring the screen right here. All I have to do is go ahead and basically put in my information and put in my password, and then my online experience opens up, and I can actually bring a conversation into our room right here. I've done it in the airport sometime. So we go every year to Mexico on a vacation because it's affordable and it's good for kids. And last year we had one of my kids who actually got a seashell who cut his toe. So my wife panicked, like all moms do, and I was more calm. So we just dialed into an online provider and gave us directions what we should buy, and we were fine. And everything was fine. Peace of mind, right? It travels with you. And we did it with this device, which is so cool, right? So online visits, the providers that you see are in the United States, no matter where you are, which is important. So you've got this amazing tool at your disposal right here, okay? Additionally, what I wanted to point out to you is, once it comes back on the previous screen, I want to locate for us urgent cares, which I feel are so super important. Why is important? It's important to know about this. By clicking on this right here, you can locate urgent cares anywhere within the United States in seconds. Okay, this is very important. And these are providers that actually we inspect for quality. We make sure it's not a moms and pop shop that just opens up. The ones that we enter into business with, they got to meet certain criteria for quality, and we check on those and we ensure that the quality is there. Some of these urgent care centers, they're like ERs, emergency departments. They're so well equipped. They have X-rays, they have blood work, they have pharmacies. So you can go ahead and look at them right here. as you can remember, I changed my zip code to 75224, so it's putting me in Dallas, Texas for urgent care centers, right? So you can see it's beautiful to see that all of this coming up right here. But I want to go ahead and out of curiosity, what is the zip code here?
48334.
48334. Farmington Hills. Yes, this is correct. And all of a sudden, you know, basically we're gonna go and look for those you know, urgent care centers. Here we go. Urgent care center. Here we go. And it's bringing them up, right? There's one just around the corner from us. There's, as you can see, Beaumont Urgent Care Center by Wall Street. This is a major one. The Wall Streets, they tend to be fully equipped with a lot of equipments. Somewhat new to Michigan, but they're really, this branding right here, they can do everything. Casting, stitches, on-site x-rays, splinting, stitching, everything. So this is quite amazing. It's literally, you can walk to it from this location, right? You probably know where they are. You can see their quality indicators, how people rated them, hours of operations, and you can also dial into their online care. As a matter of fact, they say they can talk to you video-wise. So you call them up, they give you a link, and you can talk to them. You can even do it right here and get urgent care. How beautiful is that? View their profile, and you can see all the services they offer right here. And I like this a lot. And you can see all the other locations that they have. Why is it important to really understand how this works? Because urgent care versus emergency departments are a boatload of different expenses. Really, 40, 80, or wherever you are in your plan of spending versus $3,000 if you were to have a doctor see you. There's doctors that see you in these urgent care centers, right? So you can see the providers that we work with are not casual providers, high quality providers. We inspect for certain things and we look for certain quality indicators. So you can be at peace about that. At a high level, basically, I also want to mention to you the 24/7 nurse line help, which is important. Okay, you can either email a nurse or you can talk to a nurse live. Guess who actually does most of the work in hospitals? Doctors. No, you got it wrong. It's nurses. Doctors are critical to the healthcare system, but so are nurses. Nurses stay with you from A to Z, right? So they know symptoms very well. They can give you tips. They're not allowed to diagnose you, but they can help you with tips to calm you down, to walk you through a difficult night, so on and so forth. Take advantage of that. That's also at no cost to you. Okay, 24/7, no matter where you are. So at a high level, as you can see, what does your plan offer for you? When you log into our secure member portal, you see your plan coverage, whatever benefits you have with us. If you have medical, now I'll demonstrate pharmacy in a second. Pharmacy, visual, dental, everything that you have, it comes through with us. Also, if you have spending accounts with us, you are able to see those spending accounts, your balance, so on and so forth. Prescriptions, you can manage your prescriptions, order your drugs, everything done from one spot. Now, basically, you are right here. You can log into your telephone and everything that you're doing right here. Here's the Blue Cross app. I can go ahead and just do the same thing, and I can log into the experience and do the same situation. It works. It's basically secure with my face, so it's gonna screen my eyes and make sure that I'm the right person. The same experience comes on your mobile device. At the same time, you are able to email us in a secure way. This is your message center. Remember at the beginning of the conversation, we came right here and we tested how you can talk to someone in the AI world. Whatever we talked about, it's securely safe for us right here. I'm not interested into it, so I'm just going to go ahead and basically trash that conversation and it disappears. And then you can see all the various conversations where I went back in and I actually talked to our AI engine. I had questions about my plan. I didn't have to call the employee line. I just looked at the information and it automatically gave it to me. If I don't need to interact, why bother someone? Just get it electronically. It's the same information. So you can have all that information secured for you, is safe for you until the time you choose to delete it. So this is the Blue Cross employee experience at a high level. Now, this is what I want to state. This experience that you are looking at right now, it's not a demo. This is me, okay? This is what you will be getting yourself when you join the Blue Cross family. and it's evolving continuously. Every 3 months, we tend to have a new release of the experience. Like right now, you have the member out of pocket offered to you at no cost. A year and a half ago, you had to pay for this experience. You don't have to pay right now. It's already covered by all of your administrative fees. So you can actually price those medical expenses out and see how that works and not pay for that. Additionally, what I think it's important to know, we created another resource. It's called BCBSM.com/engage. And this is a resource for you when you are an employer to actually help get the word out to your employees about everything that we have to offer in terms of engagement. These are employee engagement tools. Again, the address is www.bcbsm.com/engage. These are updated on a weekly basis. And these are the things that we have created. All the things that I talked to you about online account, we've created a whole bunch of tutorials, video tutorials. And some of those you may see me basically walking you step by step on how to put this account tool to use for you. Again, once a year, open enrollment resources, they're updated for you, and all the toolkits that are easy, accessible for you. Take a look for you. Virtual care, maternity, BCM, personalized medicine, diabetes, all of these. And you can actually download all the resources that we have created for you. We are in the flu season, so on and so forth. And then various blogs that we have. This is not a static site. This is updated continuously. This is meant for the employers to use, download resources, customize posters, customize emails, and at no cost be able to mass reach out employee populations with various resources that they have questions on. So the address is bcbsm.com/engage, from the notion of engaging your employees. So I felt that was very important to share with you as well. I think we've been talking for about an hour now, and I know the following thing. This is what my college professor told me. If you talk for 10 minutes, people will listen to you because they think you're interesting. If you talk for 20 minutes, you pretty much said at a high level what you have to say. But if you talk for more than 30 minutes, it better be super, super, super good. We talked for about an hour, and I know people's attentions can be challenged. This is being recorded as well. At any point in time you have additional questions, it will be my pleasure to further deep dive the information with you. I can dial in remotely and I can share. I can also email directly and respond to questions. It will be my pleasure. We're here for you.